Hi, I'm Elizabeth Dexter. I'm in the Department of Thoracic Surgery at Roswell Park Comprehensive Cancer Center. We operate on lung cancers and esophageal cancers and tumors of the chest wall and mediastinum, which is the middle of the chest. A lot of people who develop lung cancer are smokers. 90% of lung cancer is associated with smoking, so many of their symptoms are overlapping with things such as emphysema or COPD, pneumonias. So things that they need to pay attention to are things such as cough, unwanted weight loss, new hoarseness, chest discomfort. But again, many of these symptoms do overlap with their other symptoms of their other diseases. But if there's a change in symptom or something gets more frequent or more pronounced, that's something that they may need to pay attention to. We recommend that patients at least touch base with their physicians who are familiar with them to see if they think that they need to be seen in an expedited fashion, because maybe it is something that the physician knows that this is unusual for them, and they'll help them decide whether they need to be seen sooner rather than later. There are currently screening studies that are going on for people who are, for instance, have a strong smoking history, and sometimes these can be things that are indicated for their physician to start getting some screening CT scans, for instance, especially if they're having new symptoms or worsening symptoms. Some of the symptoms that mean that you should see your doctor sooner than later are increasing fatigue for usual activities, things that used to not make you so tired, such as your household chores or running errands, definitely things like fevers, chills. If your appetite goes down and you're feeling like your eating is not on par with what it usually is, and you're losing weight, that's definitely something that needs to be looked into. And if you're developing something like hoarseness that you didn't used to have and it won't go away, or even if it comes and goes but it persists over a few weeks or months, that's definitely something that should be checked out.